Okay, so today I'm going to perform a head, ear, eye, nose, and throat assessment. So I'm going to provide patient privacy, perform hand hygiene, gather my equipment before entering the room. So I'm going to come in. Hi, my name is Laura. I'm going to be doing a short assessment on you today. How are you doing?
Good, how are you?
Doing good. How's your appetite been?
Good.
Good? Awesome. So far I've noticed that my patient is calm, she's cooperative, she's an open affect, and her nutrition is appropriate for her. She is well groomed. She overall has clean hair, it's neat, her skin color is consistent with ethnicity as well, and just overall good hygiene. Speaking to me, I can tell that she has clear speech, it's purposeful, her hearing as well seems to be intact so far, and no overall deformities found on the head. So now I'm going to move to the head and face. So starting with this, I also noticed that she does provide eye contact with me when I'm speaking to her and asking questions. So do you know where you are today?
Yes, Springfield.
Okay. Do you know about what time it is?
Evening.
And do you know who you are? Okay.
Stephanie.
Stephanie. And do you know who's present right now?
Barcelona.
Okay. So my patient is alert and oriented. Overall, she has good facial symmetry. Everything seems to be intact. So I'm going to start by inspecting and palpating her head. So I'm going to be touching you now. So I don't notice any deformities in the skull or pressure. Did that seem to hurt at all, tenderness or anything? Okay. I'm also going to be looking at her jaw, her TMJ. So I'm going to be touching you here and then have you open your mouth for me and close. Open and close. So I hear no crepitus. It doesn't look like she's deviating at all from the midline as well. And I'm going to be touching your sinuses now. So I'm going to be pressing on it. If it's tender at all, let me know, okay? Okay. I'm also going to be checking your temporal arteries, just seeing your pulsation up here. So I'll touch you on the sides, which I have an equal pulse on both sides as well. So moving on, I'm going to be looking at her eyes. So just glancing at them, they seem to be symmetrical. There's no outer deformities that I can see on the lids or anything. I'm going to be shining a bright light in your eye, just so you know. And if you'll just look straight ahead for me, okay? Alright, and look at my pen and then look behind us over here. And at the pen, and behind, at the pen, and behind. Okay, so Perla is present. Next I'm going to be testing her peripheral vision. So I'm going to be wiggling my fingers and just let me know when you can see it, okay?
No.
Okay.
No.
Okay.
No.
Alright. If I had an ophthalmoscope, I would be looking at for a red reflex. With that, I don't have one currently, so then I would also look at a Snellen chart for her, have her stand 20 feet away, and read the lowest line possible. Also with a cover test, I would have her close one eye or hold something in front of it, go ahead and read something for me, and then switch eyes. Next I'm going to be testing her cranial nerves, so if you'll just follow my pen for me, okay? Okay, so her cranial nerves are intact, and then next I'm just going to be observing the eyes and looking at them for any color discoloration, okay? So I'm going to be pulled down. Okay, so I don't see any redness, anything swollen, or any yellow, so no jaundice. Her pupils, when observing those as well, she's about a 3 millimeter size. And I see no abnormalities in her corneas or her iris. Her conjunctiva is clear as well. Then I'm going to be moving to your ears, I'm sorry. So I'm going to be whispering in one side, and if you'll just take your hand on the other side and kind of in and out, just press on it for me. So I'm going to whisper on this side.
Baseball.
Okay, then I'm going to move to this side.
Apple.
Okay, so my patient's whisper test, she does seem to be able to hear me. Just looking at her ears overall, I'm going to move your hair over here. This side seems to be clear. It is aligned with her eye. I don't see any drainage or discharge. Once looking in more, I would actually pull back and then up to look in if I had an otoscope. Also with that, Her drainage, there's no drainage or anything, and looking inside, I would look at the tympanic membrane as well as her canal, and I'm going to look on this side as well. So once again, I would pull back and up and look inside. I see no drainage. This one's also symmetrical with her eye. The color is consistent with the rest of her body as well. Moving on, I would be looking at her nose. So just looking at it here, have you ever broken your nose or anything?
Mm-hmm.
No. And it does look to be symmetrical. What I'm going to do is have you close your left side and breathe out your right side. Take a deep breath and out. Okay. So our patency is clear over here. I'm going to be looking inside as well. So I'm going to look up your nose, okay? Okay. So her septum is midline as well. So she's able to breathe through. And her oral mucosa, or I'm sorry, her mucous membranes in her nose are clear. They're going to be pink. She's not got any drainage or discharge or anything coming out. Then I'm going to move to your mouth. So if you can just open your mouth for me and say ah.
Ah.
Okay. Stick your tongue out for me and move it side to side. Okay, and lift it up. All right. And do you have any false teeth, any accidents with your teeth?
No.
Okay. So her teeth are intact, none are missing. Her gums are pink, her tongue is pink and moist. The floor of her mouth matches the rest of her mouth. Her buccal mucosa, the sides of her cheeks, are also pink and moist. Her palate is normal, and then her uvula is midline as well. Her tonsils, she has a grade 0 since she's had them removed. And her cranial nerves work as well with removing her tongue. So moving on to your neck, I'm going to just observe from here, and I do see that it's symmetrical. What I'm going to do now is palpate, so I'm going to just feel where your trachea is and where your thyroid gland is, okay? Okay, and swallow for me. Alright. So next I'm going to put my hands on your shoulders, and if you can just shrug them up for me, okay? Okay, so she has strong accessory muscles. I don't see any jugular distension like this. If you can turn your head to this side for me and back. Okay. I don't see any pulsations randomly or when she's doing anything. Next I'm going to palpate your lymph nodes. So I'm going to be touching your neck again as well, okay? Okay, did that hurt at all? Any tenderness? No? And they're non-palpable. Also, I'm going to check your pulse on both sides, just your carotid pulse, okay? Go ahead and turn your head this way. And this way. Okay. They're equal on both sides. And then if you can just move your neck side to side for me, up and down. Okay. And she's got full range of motion with her neck. Then I would perform hand hygiene, exit the room, and document.